Mark, and my good gal, April here, who's actually been, as you'd never know it, but she's been with me for 18 years training. And she came here broken, and apparently in 18 years, I haven't fixed her yet, but we're still working and she has high hopes. Okay. But what we're going to talk about, 4 years ago, April went skiing and I made the biggest mistake I can make. I told her, do not hurt yourself or tear your ACL. So 2 days later, I get a call in the clinic. Mark, I tore my ACL on the slopes. My fault. I shouldn't have said anything, but it was COVID years and she was going to have surgery, but she's going to explain to you why she didn't. And she rehabbed and she still has not had surgery. She's doing everything that she wants to do. So I'm just going to tell you this. There are patients that we've gotten and all that do not choose to go through surgery. They want to try everything else first, exercise. And so there's people out there that have been able to avoid a surgery just by training. Now that depends on how limited they are when they're starting off. And that's certainly with consultation with your physician. You're always going to go by what they recommend, but there's certainly, if you and your physician feel like you want to make the attempt to try to rehab without surgery, because it's not like it's taken off the table. You find later on you need it, you can always get it. But April is one of our success stories with her ACL. So I'm going to let her tell you now, because not only can she talk better than me, but she's prettier.
Yes, just for perspective, when I tore my ACL and MCL, I was in a lot of pain. And so I did come see Mark, and the doctor initially, we were planning on surgery. So I was in a full leg brace and I needed to straighten my leg prior to surgery because that was going to be the mobility that I would be left with. So we really needed to try to work on full range of motion. So I came in here prehabbed, right? Is that what we call it? Before surgery. Also painful, but Mark helped me through that. And then my pre-surgery appointment, it was the beginning of COVID, and the doctor said there is just a tiny bit of the ACL hanging on. And ordinarily I would do surgery, but because of the times, let's just wait and see. I also wasn't a high school athlete. I was a mom of 4, and I could give it the time to properly heal and see what happens. That's what we did. And I still came in here twice a week and worked on range of motion, worked on strength. Now, I can't remember how many months I was in a leg brace and the timeline of weight bearing, but I came in here religiously, and I have been. And eventually I got to the point where I could move without pain. And then I got back to my weight routine, and then I returned to skiing and full activity, which I thought was never going to happen again. So I feel great.
So, and this is testimony to, if you do the work, what you can do. April, highly motivated. She works hard. Now, there was a few times that she called me names I've never even heard of, but she still did it. And she was in a brace for approximately 4 weeks. But then she came out of that and started slowly coming back. But again, the biggest thing we tell all our patients is, and April is the poster girl for this, you do the work and you'll get the results. Now, that doesn't always mean you're going to be able to avoid surgery, but at least in everything in life, you do the work and you're going to have the best outcomes you can have.
And it wasn't easy.
No, it was not.
It was not easy to give myself the time to heal. It wasn't easy to be restricted, and I was in pain. So all of that was happening while I was healing, and it was hard. I was to the point where I did want surgery because I wanted to be better. But now I have a totally different perspective of what your options are and weighing out where you're at in life and your level of activity. And yeah, it worked out really great for me. Thanks to Mark.
It's never just me. It's two. It takes two. She did the work. All I can do is tell you. And that's what's such a pleasure working with somebody like April, because she will do the work and she got the results. So there's times that hopefully we can help you, or at least give you some choices. But again, I want to reiterate, you're always discussing this with your physician. Okay. We are not going to be the ones to say you should or shouldn't have a surgery. We'll certainly help you whichever way you want to go with your consult. But other than that, you go from that and you can be like April. For those of you who maybe haven't seen the video, we did a video on April while she was in her bracelet approximately 4 years ago. That's also out there. I just want to say thanks to April for coming in and sharing this. And she is a much better speaker than I am, and appreciate it. But love this girl. And anyway, so if you have further questions, contact us. Where am I at?
Fitness for Life Physical Therapy.
Thank you.